Hello and welcome. I'm here with the lead water filtration expert at IntegriPure Newcastle and the host of the documentary Newcastles Tap Water. And we're also here with John. He was the producer of this documentary and also the lead researcher. I want to ask, in the documentary we talked about the process, what's happening at the treatment plant. And I just wanted to ask, it sounds too simple. So what's happening is the water is being chlorinated before it enters. The raw water coming in is chlorinated, and then coagulant is added, and then the solids are filtered out, and then it's just chlorinated again. Is it that simple?
Unfortunately, from what we could see, from the reports we could pull, that is exactly what is happening. That's confirmed by the people in charge. They've signed off documents saying that this is exactly the process. We tried our best to get into that plant, to see it actually, to see the whole process, but to no avail. So as much as we can say, that's the process that we see in the documentation.
Yeah, I mean, we definitely tried to get into the purification plant, as they call it. And definitely I was told over and over again, it's a political environment. And I'm not a politician, right? So I'm not allowed in the political environment, apparently. But I will say this, that as far as treating microbial problems goes, now I'm actually overstepping my boundaries here somewhat because I'm just a producer of a documentary. I'm not a water filtration expert. But if I understand correctly, chlorine is an incredibly powerful tool at dealing with microbial problems. But it's like the plant is just taking a sledgehammer to every single issue and they're just dosing chlorine at it. And it's interesting because I found documentation that suggests that the amount of chlorine they use is not being regulated. So they don't have to test it at the tap and say, oh, the chlorine's within spec. That's to my knowledge. Now, I could be wrong about that.
Why are we still here? Just to suffer?
I'm going to add to that chlorine, and I was doing research, since you mentioned that, I was doing more and more research to find what exactly is going on. And they say for Newcastle's plant, or not Newcastle's plant specifically, but a plant like that would use chlorine from about 0.2 milligrams per liter up to about 1 milligram per liter. But now the World Health Organization suggests that if you're going to, you shouldn't exceed 5 milligrams per liter. So that is a
Interesting.
That's what they say, not 5 milligrams per liter. But your pool water, which you can taste, your eyes are red when you get out there. That's sitting at about, if you heavily chlorinated your pool, that's sitting at about 3 milligrams per liter.
Wow. So, whoa!
That's just a few numbers. So it's normally within spec of, they say, between 0.2 to 1 milligram per liter. But the World Health Organization says don't go over 5 milligrams per liter, please.
Yeah, well, I can understand why the World Health Organization has that a limit, because chlorine it can affect your health. I mean, people with asthma, if they get a whiff of chlorine, their lungs just shut.
I told John this while we were working on this. Chlorine is a chemical that is used to kill microorganisms. So living things should die if we use chlorine. And we are living things. I'm just saying. But still, there's a lot of research showing that it's safe. However, there's also a lot of research that says, well, just check yourself.
Yeah.
I think the amounts of chlorine is what's in question here. It's not whether using chlorine is good or bad, because chlorine is fun to use.
I'm David, fellow director at IntegriPure Newcastle, and that's us.